The Integrated Health and Food Security Project that is currently being funded by ADRA is being implemented in 2 districts. We are targeting 4,200 households. The project has 4 immediate objectives that we're trying to achieve. First of all is in improving household food security, and in that we aim at improving agricultural production through different farming technologies. The second immediate objective is health and nutrition, and under nutrition we are trying to promote improved food utilization. We have a sanitation component. We are providing safe drinking water through the establishment of water points, boreholes, shallow wells, spring protection, but at the same time also improving hygiene and sanitation. And the last immediate objective is capacity building, which sort of embraces all those other 3 components. And we're trying to strengthen the groups that we are working with to make sure that they sustain the activities even after the project interventions, but also just to make sure that we link them to existing community structures, especially the decentralization structure, the government decentralization structure. I would say that there's quite a lot of hope for Malawi, and there's a lot of room for growth and development. I think at national level, the government is really trying to put in place policies and strategies that will help improve food security. And I think if we all really conceptualized that, we all took that on board and make sure that everybody is contributing to that, I think it's something that is leading us in the right direction. I think there are good policies, sound policies that have been put in place to make sure that the issue of food security and even health and other aspects, infrastructure development, there's a lot of potential, there are a lot of resources in Malawi that maybe are underutilized.
We have 5 thematic areas. The first one is the HIV/AIDS and STIs prevention and behavior change. The second one is that one which deals with supporting of the vulnerable households and the vulnerable people. So we are talking of home-based care. We are also involved in activities which would support or empower the vulnerable households economically. That's the income-generating activities. The other area is whereby we want the vulnerable people to know their human rights. And then finally, we are also involved in food security activities. Main areas maybe which I would say LEFAB is working, the prevention of the further transmission of the infection, and also just to assist those vulnerable households who've been infected or affected in one way or another to live positively with the situation which they have. We are targeting about 560,000 people. Chronically ill, the people living with HIV/AIDS, orphans, the youth out of school, the children. But if it's countrywide, because Tukuferanji and Let's Talk is covering the country, the whole country, then we are talking of more than 5 million people. And this is what we are doing, advocating for change to our communities. So with advocacy at optimum level, there is hope. People will know and people will eventually change.
Bye.